and then open it up to questions, if that's okay. So largely the information we're going to be sharing is around place, the campus and its operation, around people, the return to campus and being on campus, and the activity side, the education and student services. And as I said, it's a chance to hear your views and take some questions. We've got Ken and James when he joins us, and Katie and David and Dougie with us, and myself and Ellie will be able to pick up on some of the HR matters. So we move on to the next slide, please, Ellie. So just thought it was sensible to just take you through the time frame of what we've been working on. So back in June, the initial activity was very much looking at the campus, looking at the capacity of our teaching spaces, residential spaces, and the wider campus, and understanding how social distancing would change what space we had available for us as the prerequisite to thinking about a safe return. Through July and August, there have been 3 parallel streams of activity going on. There's been the detailed design and planning of both the educational offer and student services offers. There's been the work on preparing a COVID secure campus and all those arrangements. And there's also the work that we've been doing from within HR, looking at understanding and supporting individual vulnerability and concerns. As we've been moving into September, the work has moved into timetabling, keeping campus safe and building up towards the return. And also in September, we'll need to start looking at the contingency planning for when we are back on campus and that it is running as planned and being able to deal with any changes that occur as we start to be more populated. Move to the next slide, please, Ellie. So, Dougie, did you just want to talk through some of the COVID secure campus headlines, please?
Yeah, no problem. So, good morning. This hopefully won't be new information to anybody. And if you are looking for more information on the intranet under COVID, which you can find off the banner page, there is a link to a pretty comprehensive document on our return to campus health and safety guidance. The aim is that it openly and transparently captures everything that we've done and the reasons for it. I do appreciate that not everything is in there and that lots of people have questions, but I am always happy to pick those up either individually or within department meetings if people want to do so, and we run out of time today. So if anyone's interested in that, just let me know. Yeah, so we've got a sort of multi-layered approach to having a campus that is COVID secure. The first is social distancing, making sure that we're using 2 meters where possible, and then 1 meters plus where there's additional controls we can put into place. One concern that has been raised is around the student body, and can we assume that they will be as compliant with the requirements as staff? And the short answer to that is no, we probably can't, but we've designed in for that. So in all of our teaching spaces, lecturers have at least 2 meters. We've not used 1 meter plus. We've maintained that 2 meters, and we've given them additional protection because we can't necessarily assume that our whole student body will behave as we would like them to. We're still asking them to do that, and we're working with the SU and various other people. But you know, we do have to live in the real world. Cleaning, we are enhancing the cleaning, so there is more cleaning. But we can't constantly clean everything. Something is basically only clean until the next person touches it. A better way to control the spread is through hand washing, through use of hand sanitizer, through minimising things that we're touching. And we've also providing sanitising wipes in all the teaching spaces so that people can clean their own desks. So lecturers would clean their area, students would clean their own areas, and that just gives people confidence that it's been done and it's been done properly and thoroughly as they would like. Hands and hand sanitizer I've talked about. We aren't providing hand sanitizing stations outside every single building. We've done it based on footfall and the number of people. We would still expect people to wash their hands whether they were able to do so, because it's a more effective way of controlling COVID. Face coverings is another slightly sort of emotive topic, that the college's view is to strongly encourage. Without getting into the detail, it's extremely difficult to practically mandate something. So, you know, I'm asked frequently, why aren't we mandating face coverings? For us to mandate face coverings, we would have to expect people to wear them, and there would have to be some form of policing and sanction if they didn't, because we're saying that this is required. So where we say somebody has to wear PPE in a lab environment, if they don't, they'll be kicked out of that lab. If they continue to not to do so, we would potentially look at performance management and even disciplinary action. So we don't want to put face coverings on the same level as that. So essentially, again, it's about being open and transparent. We could say we were mandating, but we wouldn't be. So let's say what we're actually doing, which is strongly encouraging. And it also ties in with there's various reasons why people can't or don't want to wear face coverings, through medical reasons, through disability, or through triggers. And I think part of us being an open and supportive community is understanding that people may not be able to wear them, and they may not want to discuss that in public. So that's a sort of brief summary, Helen.
Thank you. If we go to the next slide, Ellie. So the other part that sits alongside the Safe Campus has been the work that we've been doing to look at individual vulnerability and concerns. A lot of this is wrapped up in the return to campus conversation guidance that has gone out to heads of department, heads of school, and is underpinned with the content on the intranet. And this looks at the combination of the transmission risk in the workplace, which Doug has just talked about, and the individual vulnerability that an individual brings because of medical conditions, ethnicity, BMI, etc. So we have a clear process that's in place for that, which hopefully you're familiar with. We've been looking at the commute. We know that that's been a sense of concern, and we've got some additional content now on the intranet that's looked at some of the commuting routes, key commuting routes, and their use, as well as hints and tips on how you can keep yourself safe on the commute. And what was interesting, the two charts that you can see on there showing the current volumes of usage on the network, and this is particularly Waterloo and Victoria, but stands true for other major stations, is sitting at about 30% of the usage that it was back in February before lockdown started. So a much quieter network, which hopefully will be reassuring for staff who are coming through those areas. We've also looked at, that sits within the practical guidance side of the work we've been doing, but also there's been emotional support in place as well for how staff can deal with some of the anxieties that they might be feeling. So the content has largely been in the Working Well Hub. It covers both the returning to campus, what the campus will be like, and although not the focus for today's conversation, content in there about working well from home, which we need not to forget that there are a number of staff who will be staying working from home, either fully or partly, for the next few months at least. So that was some of the work that we'll be doing on individual vulnerability and concerns. If we move on, Ellie, to James, if you want to pick up on these slides, if you're with us now, I believe.
Sorry, no, I am. My apologies about that. I struggled to get into the link to work. Okay, what we're trying to do is draw up a staff journey to help people understand where to get all the information. This is a little bit of work in progress. We've got to finish it off. There's a few more pieces of information. But the idea is to look at, so that everybody can see, and we'll put this up on the hub and we'll share it with everybody, where particular things are going to happen. So it's put the training dates in, and where the sort of drop-in sessions are going to happen for the flexible education. And it's also got the dates for things around the Safe Campus sort of mentioned there. And so you'll be able to see this. And this is really designed to help staff to know where to go. Could I have the next slide? Because then should show us, yeah. And then it actually then will have a links to all of the resources and key information. So you'll be able to find everything that you need. In one single space, and you can see, you can find that, Return to Campus Hub, the Flexible Education Hub, the particular policies and guidelines. So this is designed to make it as easy for everybody as possible to find the information they need. We're still not quite finished with working on it, so if anybody sees anything in these two slides that's missing, I'd be very, very grateful for any sort of corrections and suggestions. And obviously, we're trying to get this out early next week. All right.
Move on, please, Ellie. So one of the things that Erica from Marcoms has been supporting us with is a Play in Your Part campaign. This will run for both staff and students, and it's really about reinforcing the personal messages, well, the messages that we all have to take personal responsibility for keeping ourselves and each other safe. So this is something that is going to play a growing part, I think, of the communications, with a view that it will be launched from next week, sometime next week. So it's just that reminder to each and every one of us that all the efforts that have gone into creating a safe campus will only be maintained as being safe by our own personal behaviours within it. So there'll be more on that over the coming weeks. Katie, were you okay to just talk through some of the students who a big part of who we share the campus with?
Yeah, sure. Thanks very much. So in terms of some of the changes that have been made to how we're getting students back on campus, there's been a look at the room allocation. So, for example, we've had to reduce the number of students going into some halls where they've got shared bathrooms. So particularly in Founders, where they were sharing bathrooms between about 6 or 7 on some of the corridors, they've been reduced down. So we'll obviously have some void rooms in there, but it makes it for a safer environment. We are labelling those corridors, or indeed the where we've got kind of the bubbles of students, as households, so that they're aware of who their household is. We've therefore got 3,000 rooms available, and we're anticipating at the moment, due to our good undergraduate recruitment, that we will achieve that. As I say, that's obviously a limited number because of some of the distancing. In terms of getting ready for that, the rooms are being cleaned and sanitised and locked and kept in that state before move-in. The move-in themselves is being done over a much larger period of time, so that students have got more space and families have got more space to get themselves here. Obviously, we've just been talking about the Playing Your Part campaign, which is going to be going live. And also there's going to be new washing facilities and developing a cashless campus, so that there's less I think money in direct contact. We are preparing and have already got some students on campus who are quarantining. They are in specific rooms, and specific measures have been taken to ensure that they get food and other supplies safely.
Next slide, please, Ellie.
Thanks. As I said there, the move-in period has been increased from usually a chaotic weekend to now 11 days. And college cards are going to be issued to students on arrival, so they can use those. The different services that they usually get in halls are going to be now delivered through a mixture of face-to-face and online. And there's been a lot more sort of updating of FAQs around services. And we've introduced a chatbot for frequently asked questions. All the social distancing measures will be introduced at all service points and help desks. And any service personnel who need to enter households to deliver services have got special etiquette that they need to go through as well. Thanks. Next slide.
I think that's our last slide there. So hopefully that's given you a little bit of a recap on some of the work that's gone on around the campus, around the people, around the activities, and our students as a key share of our facilities and campus. So really it's a chance now to pick up on questions, clarifications, or suggestions that you have. If we try and go with the raising hands, I think that would be helpful.
I might just, quickly say something more about student activity, because I realise there is no slide on that. So we've been working really closely with the Student Union. I think we're very aware that students have got a desire to come back onto campus, but also once we get them back, we do need to create and sort of socially distanced opportunities for them outside of class time. We think it is better that we put on events and control them. So there are a number of events which will be online, but also the Student Union have been working to increase their outdoor capacity around some of their key venues. The nightclub will not be opening during the year, we don't consider, but also there'll be some freshers events going on, for example, an outdoor cinema in Founders Square and things like that. So very much the policy there is that we'll be working with students who'll be working through quite strict codes about how they book tickets, having to go into their household bubbles during those types of outdoor events even. But I think our policy is to make sure that we try to provide some structure for them so that they're not kind of let loose to invent their own, or indeed let into Egham en masse to create their own entertainment, as it were, down there. Thanks.
Any questions? Ruth, would you like to, it's quite a long thing you've put in the chat, would you mind just providing a summary and raising that question, please?
Of course. Sorry it's long. I thought it'd be easier if I popped it in the chat because I stand a large chance of garbling it. Thanks so much for all the really helpful and information and all the work that's gone into it for all the measures on campus and for a safe return. This is another version of my usual question, but it's all the more urgent, I think, now. We were talking about this in a school planning meeting the other day. The welcome idea that there's now going to be 24/7 support for students, as mentioned in the Bridging Wellbeing Strategy. However, it's not clear to us at the moment, or certainly not clear to me, how that's going to be delivered. And as ever, our attempts across the community to support our students does have an effect also on our own mental health. I've not personally been made aware of any growth in student advisory and wellbeing services. And we do know that, COVID-19 is going to has an effect on our students' mental health as well as our own. And we also know that they're going to be more isolated and have a lot more time on their own. So that's where that's where I'm hooking some of my anxieties at the moment. Thank you.
Okay, thanks. I don't know if we've got anybody from student wellbeing here, actually, have we? No, I think certainly from, so we might need to come back with some more detail around that. And what I didn't say at the start is part of what this session will do is flush out the unanswered questions and will enable us to get more content to put onto the Q&A and to share. So I'll add that in. I think from a staff wellbeing point of view, I think the preference would be on the prevention rather than cure route, and trying to, some of the content that's around there with helping people recognise anxieties and recognise how they can support themselves in managing those anxieties, I think will put us in a better place than trying to pick up the pieces once people have started to suffer the effects of ill mental health. We will be keeping a track on our absence stats to see both whether there's a change in absence contributed either to by COVID or mental health reasons. But certainly the well-being of staff, there are the usual provisions in there with the mindfulness sessions that are run that would encourage staff to engage with, and also some hints and tips about managing your own anxieties. As ever, if staff have suggestions of things they think would be particularly effective that we've not considered or not looked at, we'd be happy to have a look at those and put that provision out there. I think it's not overwhelming people, but trying to have things that would feel relevant and would feel helpful.
Okay.
We have some hands raised, Helen.
Okay, Roy, I can see has got a hand raised.
Yes, here I am. Yeah. Can I go ahead with my question?
Yeah.
Well, I'm sorry if I've missed the kind of facts about this, but I'm interested to hear something at least about a testing regime for students on campus. What is going to be in place to, follow the kind of guidelines that the independent SAGE report on reopening university campuses, along those lines? What sort of testing regime for students?
I think maybe David and Dougie can pick up about some of the conversations going on with Runnymede around.
I can speak to that unless David wants to.
Go ahead, Dougie.
Yeah, it's a really good question, Roy. So I think there's two types of testing that have been discussed. There's your asymptomatic sort of screening testing, and then there's your symptomatic testing. So asymptomatic testing is problematic for a number of reasons. It is usually gives quite a high degree of false positives, so up to 30%. So it's quite a blunt tool and quite a disruptive tool. There's a difference between testing which can be used for research and testing that can be used for sort of clinical reasons, if that makes sense. So simplistically, if you're going to tell somebody that they've got a disease, you need to be sure they've got a disease. What you use for research purposes, you can play with the statistics to deal with that. So we have looked at whether we could essentially pay a third party to provide that sort of testing. The costs very, very roughly are about £1 million per term per 800 people. It's a huge amount of money to have this done privately. I have also discussed with Tamar, who is looking to see that potentially there may be a research opportunity. So potentially Southampton are doing something around this. But again, just because it's done for research purposes doesn't mean it can be used for clinical reasons, if that makes sense, because they're not necessarily very effective. So asymptomatic testing is basically not practicable. In terms of symptomatic testing, we've been working with Surrey County Council, and we have an agreement in principle that they will put a testing centre on campus grounds for the next 6 months. So it won't be ours, it will be to support Surrey and Runnymede in general, but we will be able to have that on our doorstep to be used. Now that's an agreement in principle with them. They're keen to do it. We're keen to support them. We're working through the details of exactly where and when. And they can also surge an additional testing facility if we needed it. So basically, we can't do screening testing. We've looked at it. It's very, very difficult to do, very expensive to do. But what we can do is provide, rapid symptomatic testing through the NHS effectively. I hope that answers your question.
Yeah, thanks, Douglas. I was rather admiring this morning the success at Arizona State University at heading off COVID on their campus by testing effluent feces.
Yeah, I mean, so there was a paper from one of the Ivy League universities looking at this as well and how they were planning on doing it. But again, it comes down to whether your health centre supports that, so your health system supports that, and essentially, the size of your bank balance. It's an awful lot of money, and we're not necessarily in the position to spend that amount per term. It also can bring a great deal of disruption as well. So again, the paper that I read from the Ivy League, it was 30% false positive rate. So they would test everybody. 30% of staff and students would then have to self-isolate while they did a second test. I would have real concerns as to how long people would take that first result and not go, oh, well, it's been false the last 2 times, it's false this time, and just start to ignore it. So I think there's real sort of psychological aspects in terms of how this runs long term. But that's kind of a wider discussion for another day.
Okay, just in the interest of moving on and trying to cover a few more topics, I noticed there's some questions in the chat, but Ellie, if you can just call in some of the hands up, I'm struggling to see them, and then we'll come to the chat questions after we've had a couple more hands up.
Okay, so the first one that I have, I apologise, I don't have your first name, is Jay Cordova Pacon. Are you there?
Yes, hello, it's Jose Rodrigo, School of Business and Management. Feeling anxious because I'll be lecturing around 500 people in different sessions, and they have been squeezed in one day, and I understand the logic, but this could be really draining for me. And as much as I understand the preventive nature of what has been done, I agree with the person who talked before about having some on-site support for when we are feeling tired or down, and not just putting the responsibility on ourselves for our mental health and well-being. That's a comment. I have a question, a couple of questions. Would there be plans for emergency cleaning? And I'm also talking about the lecture rooms. Who's going to do that, if it's the lecturer or there is a dedicated team? And what sort of behavior do we have to assume as lecturers prior and after our face-to-face sessions? Just put our mask and recite things as robots and go away? Or if there is a student who wants to have a kind of conversation, what's the protocol? And the last thing I want to say is, of course, we don't want that, but what happens if there is an outbreak on campus? What are the plans? Are just people being told to self-isolate and wait, or how is that going to work? I mean, I'm sure you're working on risks, so I'll be happy to hear that. Thank you.
Okay, so probably if we pick those up, noted your points about mental health, and yes, you're right, we need to look at on campus as well as self-responsibility. Dougie, did you want to pick up the first questions around delivery in the classroom? Then James, maybe some of the protocols, and David, the scenario, the contingency planning.
I can pick up on the classroom. I mean, so essentially, as I sort of said, we're trying to make every teaching space as safe as possible. I noticed in the chat you had a question about what if someone is suspected. You know, we've spoken to Surrey County Council about this, and the way test and trace work is they look at the procedures that you've got in place. So, you know, if you've delivered a lecture in Windsor and somebody in your class is suspected or confirmed, they would look at how we've set things out and say, well, actually, there's no real chance of you being infected. So the dog disagrees with that strongly, but
that's
yeah,
contingency. That's contingency.
yeah. So in terms of the classrooms, you know, everything has been set out that the best way that we can to protect everybody, both lecturers and the staff, in terms of social distancing and the cleaning. You asked a specific question. We're looking at contingency planning, additional cleaning. You know, will be part of that. I haven't got the detail yet because we haven't finished writing it.
Sorry about that. Thank you. James, was there any thoughts on the question around individual questions that may emerge from students at the end of sessions?
Yeah, sorry, we haven't actually planned anything about that. I think it's we're going to have to. It's a good point, and let's take that away and have a think about it. I think obviously it might be a case of asking people to contact you via emails or Teams, and obviously people will still have planned office hours and things like that. My sense, I think it's a really interesting thought, is we're not going to be able to be quite as informal and free flow as we used to be around the teaching. So it might be a matter of sort of saying, like, if you've got a question you want to ask me afterwards, then there's a slot, you can come and do it. But thank you for the thought, and we'll just have a bit of a conversation about how that could work.
Sorry, David, did you just want to touch on the scenario, the contingency planning aspect?
Well, I think, Helen, that Dougie mentioned that we're actively thinking about the contingency planning. I don't think I can add to that.
Okay, sorry, I was sorting the dog. Apologies, that's everybody. So if we just pick up a couple of the chat questions, Walter, I think Dougie just covered yours off, and David asked about face shields, which Dougie again has answered in the chat.
Sorry, Ellen.
Yep.
Excuse me. It's you just mentioned that it was actually covered, but if you don't mind, I would like to point something. Can I quickly?
Yes, of course.
Because we are suggesting, well, we are invited to have a 50% face-to-face. I hear a car going through. Is it only me, or like traffic?
If other people could mute who aren't on, that might help.
Sorry, it's just I really can't hear anything. Basically, I was thinking, because we got 50% face-to-face, that's a quite big number. And is it? Do I understand correctly that, let's say, 2 students or a staff and a student test positive? That obviously that module, it's been in contact for a few days in the same room, but also students are in contact with other modules and lecturers too. So you create a network that for several days they've been in contact, social distancing, but there is a contact in a closed environment. So at the moment, we don't have a clear backup plan for that. Is it clear? Is it how it is?
Dougie or David, this was some of the conversation we started on yesterday, wasn't it? Do you have a bit more detail on that?
Yeah, so in terms of the contingency plans, we had some running into lockdown. So we had planned how we would manage an outbreak in February. We dry tested some of that to see if it would work, and it worked fairly well. We're obviously just updating that and looking at that and how we would manage specific parts of it. But again, it comes back to the sort of public health England criteria of close social contact of within 2 meters for more than 15 minutes. And track and trace will look at that. Who have you been in contact and how were you in contact with them? So if our procedures and processes are good in the areas that we can control, then we don't necessarily have to worry about that. It is, you're absolutely correct, that the spread out of our control within the student residencies and the student halls, which is why we're looking at messaging on personal responsibility for students and the student code and all these sort of things. So there is a large element of personal responsibility to COVID-19.
And the last thing, sorry, because when we mention asymptomatic and testing, where are we talking about the antibody testing? Because PCR wouldn't have much of a is it the serological testing we were talking about?
Yeah, we're rapidly moving to the edge of my knowledge on this matter. So bearing in mind that somebody from biological sciences might pick me up on this.
Well, it's me, and I'm also a virologist.
Okay,
so
well, there we go.
We need to be careful when we use the term asymptomatic, because but this is something we can discuss later, because that's it could be a complicated to use the term asymptomatic and say that 30% are a false positive. It can create a lot of raising questions, because with PCR, an asymptomatic should be 100% or 99% picked up. There is a problem with certain testing, like serological testing, and that's another thing. And then there is another problem, which is people who are considered asymptomatic, but they're just past the period. They are not spreading anymore, but they're basically healed. So there is a lot of terminology that I'm just telling, because we might use terms in a wrong way and then to end up in some, that's just, sorry, it's just something I wanted to point.
No, that's helpful, thank you. We'll just pick up a couple more on the chat and then we'll come back to hands up. So there was one around student behaviour, which I know you've answered, Katie, but I think it is a question that I've heard come up more than once. So do you just want to talk a little bit more about the student behaviour side?
Yeah, thanks very much. As I said, I'm not sure if Helen Gronendale's on this call, but certainly the student advisory have been putting together an updated student code and obviously tying that into the disciplinary procedures so that we are quite clear about the behaviour that we're expecting students to follow, and that it now sort of fits in with the expectations we would have around them maintaining social distancing. I think that policy is ready, but I'll double check, and it might be a useful thing for us to get flagged onto the staff newsletter. So I'll talk to Erica about that as well.
Okay. Thanks, Katie. So if we take another hands up, Ellie, do you know who was?
Yes, so we have Alba Chafaro. Are you there?
Yes, thank
Hello.
you. Sorry, thank you for all the information. I might be repeating something that's been asked, but it was left a bit unclear for me. Some of us come 4 days, are going to be teaching face-to-face, all the language tutors, for instance. So we can have up to 18 hours of contact a week. So what happens really if there are students who test positive in your classes? I mean, do we need to self-isolate? Some of us live on our own, so don't have family. Some colleagues need to commute long distances. What happens, or what happens if you yourself test positive? Who is going to take those classes? Because if you are able to be online, I mean, is that term as being ill, therefore you don't connect? If you are really ill, you are unable to connect, obviously. How would that work? I mean, I'm still unclear.
I'll pick up on some of those aspects. I think as Dougie said before, we'd be governed by the track and trace approaches and how long had you been in contact and close contact and whether they picked you up. In terms of the personally, if you were ill, it would be the ordinary processes that we have that pre-COVID, we'd have people were taken ill with flu or were otherwise unable to undertake their role. So if you're genuinely ill, whatever procedures were previously in place for managing absence would, I think, kick in. So I think schools and departments will have backup plans for how they reallocate teaching or whatever. So that would stand as normal. Mm-hmm. And if it's you're in isolation, then again the provisions that we've got in place for being able to teach online and remotely would, I think, be the premise rather than not working. So I think from that side of things, I'd see the schools and the departmental arrangements kicking in as they usually would have done. Dougie, I don't know if you want to add any more other than what we've said around track and trace. It's really down to how those procedures would kick in, which I know isn't an absolute answer to your question, Alba. But
I'm just worried about the self-isolation. I mean, not about from the point of teaching, because you can, as you say, you can teach from home, no problem. But it is from the personal point of view, because, for instance, I don't have anyone who is going to do anything for me. My dog sadly cannot do it. So that is giving me a lot of anxiety. So.
Yeah, I think the point is, Alba, that what we'd look to do is be really open and transparent about what the plan was. So, you know, I've got to draft something for David, you know, pretty soon after a meeting we held yesterday, and then once that's agreed and confirmed, you know, we would look to share the detail with staff. Okay, this is what would happen if you had a suspected case. This is what happened if you had a confirmed case. You know, this is what our plans are. So we can't give you that answer yet, but what I can say is we certainly will give you that answer. You will know before the start of term what would be expected to do.
Okay, thank you.
But we would look to follow, you know, the medical advice of the experts. So, you know, if you're symptomatic, then you go home, self-isolate, get a test. If they assess that you had close enough contact to need one, then we would look to ask people to self-isolate. But again, you know, everything that we're trying to plan with from the safety point of view for the lecturing is to make sure that, you know, even if you did have someone with COVID in your lecture, you should not be at risk.
Okay,
So if we start at that as the point, you know, obviously we would hope that our students would behave and not come in if they were symptomatic, but even if one did, it shouldn't cause us to have to self-isolate whole classes and lecturers and all of that. So that's very much the aim.
Okay, thank you.
And actually, Albert, we did have some resources available for support that was available in the community when we were more in lockdown for people who were living on their own in different support groups. What we can have a look at is how much of that is still operating, and make sure that staff, if they are living on their own and do contract COVID and are in the position that you talked about, that if there is help in the community for various things, that those links are easily accessible for staff.
Okay, thank you.
You're welcome. Ellie, did we have someone else waiting with a hand up?
I don't think we do, no. I think we've gone through all the hands.
Okay, so if we move back into the chat, David asked a question about face shields being arranged, and Dougie clarified that that's through the school admin offices and departments. So hopefully that answers that question. We've talked a bit about student behaviour, but there was a particular question around conflict in the classroom and enhanced security presence. I'm not aware that we're putting in place enhanced security presence, but Peter, do you want to talk a little bit more about that concern? Is Peter still with us?
Sorry, I was on mute. It was raised by a couple of people yesterday in a ISG meeting. Just that what we do if students are being upset by people wearing face masks, not wearing face masks, getting upset by this sort of thing. How do we step in? How do we deal with that situation? And what security presence could there be in case there are issues like that?
Sorry, Katie, were you?
No, I mean, I think, as you said, Helen, we're not laying on additional security. There are always security on campus, and they will remain on campus. So I think, as in any other normal situation, if you found yourself in a place where you believed that you needed help, then you know, I would suggest that people obviously have the security number to hand, and you would phone them. But I think that's no different from any other sort of episode on campus that hopefully we don't see too many of. But yeah, we're not laying on additional security. I think, as we've been saying, I mean, we're trying really to work through colleagues and students taking on responsibility and working through codes so that people do understand that. We are aware that there's going to be some more guidance issued to universities next week, coming from the Department of Education, and we're going to look very closely at that guidance. I think it's likely that that guidance will probably step up a number of measures which we've been putting in place anyway. So in a sense, that guidance, I think, would be welcome, because it then will lead to sort of clearer sense of conduct amongst all universities in the UK.
Okay, thank you. George raised a question about international students, but not staying in the college, and how we're reassured about their 2 weeks quarantine. I don't know who's best placed to answer that.
Helen, I'll have a go, given there's silence. So those students who are going to reside on campus are relatively easy for us to deal with. Indeed, we have almost 40 students currently on campus in quarantine at the moment. They're being looked after. Katie made brief reference to those. George, you were referring specifically to those that are in private homes, I presume, because we need not worry too much about those in Hawks Park or the Podium or the Pod, because we have an agreed set of protocols with those private halls that they will effectively administer our procedures. But the students in the private homes, in multiple occupancy homes in Egham, Englefield Green, or similar, we are slightly less able to manage those students than we are those on site, of course. Students who we believe need to quarantine on arrival have been written to, or will be written to if they're not in the first tranche. That correspondence sets out the government's position and our position and our expectations of students and how they can access support when they are in their HMOs. Where we can't go, of course, is effectively police behaviour. We won't be policing the streets of Egham to make sure our students are entirely compliant. And that again is consistent with the emphasis in all of our activities here, that we are asking students and staff both to manage their behaviours as we would ask them to in this period.
Okay, thank you, David. James, did you just want to update on some conversations we've had with the Students' Union around their commitment to helping us managing behaviours?
Yeah, so it might just worth sharing this with colleagues. We had a similar briefing last week with the students, and they have a lot of the same sorts of questions. But I think what was most striking about it for those who were at it, certainly that the leadership in the Student Union and the reps that were there are very, very aware of their need to play their part in keeping the campus safe. And so I think we've got quite a strong sense amongst the leadership of the student community that this is something we've all got to work on together, and that I think there will always be people who will not behave and who will break the rules. But I think we will find that the sense we got is that the students are going to be really very responsible about this. And I think part of our job in the next kind of month or so as we go into term is to really sort of encourage and reinforce that kind of behaviour amongst them. And I think if we set the right tone around this, I think some of the sort of the things that we might be worried about misbehaviour and so on, may actually turn out to be less problematic. So I think it's very much about trying to think about this, about part of our job in this, I suppose, is an educational one, that we need to educate them about how to behave to keep all of us safe. And to also to think about their own risk as part of that, being members of a responsible community. And I'm quite hopeful that the Playing the Part campaign is going to be quite useful in that respect. Okay, I hope that's helpful.
Thank you, James. Moving on to a slightly different topic, and probably one for you, Dougie, around somebody who works in the library building, large building with air conditioning and no windows, and the question about ventilation and the role that that plays in airborne transmission.
Yeah, so I answered that specific question in the chat, but I'll pick up the sort of aerosol risk one very quickly and very generally. And I'll again reiterate, if people have specific concerns, I can speak to you personally or as part of the department or school meeting. So essentially, some of this comes from a misunderstanding of commonly used scientific terms, which is happily something we've already covered in this, and about the risk of how COVID has spread. So I've asked our college biological safety officer, Chris Wilkinson, to look at this, and he's doing a short video today on campus to sort of explain a little bit more about how COVID-19 spreads and what is meant by respiratory droplets. But essentially, at the minute, there is no evidence that COVID spreads through inhalation of COVID particles in the air, then leading to COVID. That doesn't mean it doesn't, but it means there's no evidence, and then we get into a whole separate thing if we start talking about that. So essentially, from that point of view, the aerosol risk is being somewhat overstated in the media. In terms of ventilation, the government is being quite disingenuous about this. The requirement that they've put in the COVID guidance to provide ventilation is cut and pasted from the standard Health, Safety and Welfare Workplace Regulations 1992. So they're saying what we need to do is the same as what we've been doing for the last 28 years. So that's causing a little bit of confusion and worry from people. That said, we do have some small, poorly ventilated hot rooms, and where we've got them, we're looking at them and how we can do things differently within the budgets and the infrastructure that we've got. So that is being reviewed, especially for the teaching spaces.
Thank you very much, Dougie. There's a question from Hannah. Is it? I can just see the first three initials of your first name about accommodation, and Katie has responded that Gillian Almond is looking to see whether we can arrange a deal with the Travel Lodge at a reduced rate for staff who would rather stay over rather than do 4 commutes over a 2-day period. So we're looking into that at the moment. Where do we go next? Roy asked a question that if COVID does appear on the campus, how quickly will all staff be told?
And Douglas has replied in the comments.
Oh, has he? Sorry.
Yeah, good reply. Thank you.
Thank you. Trying to work through them.
Helen, I think we're probably down to Roy Booth's comment at 12:20, which is around, we've obviously had a process where some people are working long term at home and dealing with risk. It might just be helpful to talk a bit more about the assessments that are being done for people.
Yeah, thanks, Katie. I was trying to read through them. That was helpful catch up. Yeah, so as we said, the focus has been more immediately on the returning to campus and those aspects of it. We do still have the guidance in place for people who are working from home and the workplace assessments, which Dougie, you might want to add a little bit more on about making sure that you've got a safe workplace. It is really important, and we will pick up some of these messages again once we get the return to campus sorted, around the keeping in contact aspects of staff who are working away from campus, making sure that they remain engaged with the workings of the directorate or the school or the department and feel part of that. And that communication side will be an important part of keeping them engaged and making sure that they are safe in their work environment whilst remote from the college. So Dougie, I don't know if you want to pick up any more on the more practical DSE aspects of their home working environments.
I mean, essentially only to say that we have e-learning, both training and an assessment for DSE that will help people set out their workstations. That's been available since the start of lockdown, as has some guidance on how to set up a temporary workstation. There's also a route through IT if you use specialist peripherals that you usually have at work, and to have those either collected or sent home, and that's been in place for quite a while as well. So if people have specific DSE concerns, if they email the health and safety at Royal Holloway inbox, we can give them some assistance.
And I think there's another aspect to Roy's question, which was we'd obviously also previously had categories of extremely vulnerable people. And Roy, just to say that line managers have now all got sort of briefing documents in which they can talk through with individual members of staff and do risk assessments about people returning. We've got a group of staff who are in effect doing back office jobs who for the moment we have decided wouldn't be returning to campus. So those who don't have face-to-face contact with students or some of our operational matters at the moment would be staying off campus as well, so that we've got further space to socially distance those that are remaining.
Thanks, Katie. I have a meeting with my head of department this afternoon, in fact.
Yeah, we are using referrals onto occupational health, both for help with medical assessments, but also for staff who are feeling anxious and would like some support on dealing with anxieties. So the next question was around face masks and the wide range of use of materials. Does anyone know the specific details of our face masks?
I've picked that up in the comments as well, Helen.
Oh, did you? Sorry, not scrolling down far enough. Okay. Sense of support for everybody. It's not enough in my region. Okay, so the next point in the comments was about creating a sense of support, and that it's your responsibility isn't enough and will exacerbate anxieties. I think that's true. And part of this session has been about trying to talk about the efforts that have been put in place to try and create a safe environment, personal behaviour within that, whether it be the student behaviour, which we spent quite a bit of time talking about, and staff behaviour within that is important. But you're right, it's not the only things. They have to go in partnership. But I think the concerns that were being expressed to us about student behaviour very much plays into, it's important that we do stress to everybody that personal responsibility is important, but you're right, it's not the only thing that will make or break, and we do need to make sure that staff know what other mechanisms are in place to make sure that the environment that they're working in is safe, and that they can feel that they've got access to support should they feel they need it. So it's a good point. And yes, the be kind to each other is a very important message in this. I think there will still be some challenges. Dougie mentioned some of them around mask wearing and behaviours, and I think we need to be challenging about behaviours, but supportive and look after each other in this. Okay, sorry, are there any other unanswered questions that we've not picked up?
There's one right at the bottom, Helen, about when we will know if windows will be made openable, etc.
That's an ongoing task, Helen. I'll chase that up and get back to Tom.
Okay. Well, I'm conscious we've run to our hour. Was it set up for an hour? It was, wasn't it? If there were no other questions, are there any more hands up, Ellie?
No.
No. Well, hopefully you've found that useful. I think it certainly raised some things that we can look into and make sure that our provision is further enhanced so staff do feel safe and supported. I hope you found it a worthwhile use of your hour, and thank you both to the panel who've helped with the questions, and for yourselves for being very open with the questions you've raised. Okay. So other than that, then I'll just say goodbye from me, and thank you for everybody for attending.